at Baird from Superior Healthcare in Navarre. Again, I'm here today with our new patient. She's sitting right here. Today's our report of findings day. We're going to go over x-rays. Emma was in a car accident a week or so ago. We did our initial evaluation. We explained the insurance, the way the Florida insurance no fault works in this state. We're here with her mom, and we're going to go over her x-rays and talk about what we need to do to get her feeling better. Now, x-rays are your first step in helping to diagnose or helping to figure out what's wrong with the patient. It's the easiest and simplest form of diagnostic tool. Always started with when a patient goes to the emergency room, they get CT scans, which is a glorified x-ray, or x-rays to rule out fractures, dislocations, and tumors. Okay, we do them here as well. We have a really nice digital x-ray system, pulls right up to the screen. Very clear, very precise on what we're doing here. So we're looking for those things as well. So in the medical world, they look for those things. In our world, we look for those too. But we also add another dimension to what we're looking for. Keeping in mind that the spinal column is made of 24 moving parts. There's 7 in the neck, and right here we have an x-ray of her cervical spine, looking at her from the side. So we've got 7 distinguishable joints, C1 through C7. So we've got a cervical film. We ruled out fractures, dislocations, and tumors. We know that now there are soft tissue injuries because she's in pain. Remember, the soft tissues, and you can't see soft tissue on x-ray. You can only see the spaces for which the discs exist. We know there are ligaments that hold bones together. There are tendons that anchor muscle to bone. The nerve tissue sits right behind that column of bone. Those things are what gets damaged. So if we have damage to those supportive structures, it's possible that because the vertebrae are moving parts, they can move or shift into other positions. And we also want to make sure, since those ligaments and tendons hold these bones into position, is the normal position here? Is there any variation from it? If there is, we want to correct that, because if you let the vertebrae heal in a position that's incorrect, it's going to cause you long-term problems. And as a young patient, young woman, we don't want her having long-term problems. And of course, the older the patient, when there's other problems, arthritic and degenerative changes, we're a little more limited in making any change, but we still want to assist in the tissue. It's a little, not reversed, but it's almost in a military fashion. We call it a military neck when it's very straight. She's got a little bit of a curve here, but we need a little more of a curve. Okay, that's where a normal cervical curve sits. This isn't horrible. This isn't the worst case scenario. I see them when they're completely reversed. That's a worse condition. And the point is here, what's the big deal? So there's no cervical curve or less cervical curve. Well, if the head weighs 8 to 10 pounds and it sits on top of that column of bone, if the distribution of weight is not there based on the curve, it's going to cause more accelerated or increased pressure as you move down the spine. That's a problem. That's a problem because it will cause these joints and these discs to wear out faster because they're under more stress and pressure. We want to eliminate that. So in our treatment, in our rehab and the way that we do our treatment here, we want to help restore normal cervical curve, in addition to allowing soft tissue healing. Okay, so this is the lateral. We'll show her some things to help you work on this. But again, we don't know the extent of soft tissue injuries, because once we start treating the patient, if they don't show improvement, the next step is to get a little better diagnostic tool. And the other tool that we will refer patients out for is an MRI. An MRI is going to be a lot more specific and especially determine, is there injury to the disc? If the disc is injured, it's very easy to determine that with an MRI. And a lot of times we do it initially if a patient's exhibiting a lot of radiating symptoms into their arms or into their legs from the lower back. We'll send them out. We will send them out for MRIs pretty quickly. Okay, so this is the cervical spine from the side. We also take opposing views, because we want to see not only the side, but this is also the front. Now, if we look at this film, this is the left side, this is the right side. So this is as though we're looking at the patient from behind. This is an open mouth shot, so we can see the top 2 vertebrae, and we're looking here for anything that's out of the ordinary. For her, she's a young lady, it looks perfect. There's good, perfect alignment here, good position of C1 and C2, and they're numbered, of course, C1, 2, 3, 4, 5, 6, and 7 as we move down the spine. Once we get into the thoracic, you can start seeing the rib attachments there. Cervical spine is mostly injured in auto collisions because of the way the head gets pushed or positioned very quickly forward and back through that trauma. Doing that causes that damage. We don't typically see fractures in these kind of things. I'm not saying it can't happen, but it's not very typical. So for her, our priority is not only restoring normal cervical curve, which we'll show her in rehab, also mobilizing the spine and doing all the stretching and the rehab to accelerate soft tissue healing. This to be a very subtle curve here. This is the remember, when we look at someone from behind, we want to see a nice straight spine. There's a little curve going on here. It's not significant. People get all bent out of shape when you hear the word scoliosis. I would not consider this to be a scoliosis. If so, it would be very mild. If I were to measure it, it would be less than 5 degrees. Not a concern. Is it a concern for the patient? Depends on the severity. If a scoliotic curve is more than 20 degrees, it's something to be concerned about. It's not the case here, and it's not what we're looking for. Her pain exists in her cervical and thoracic spine. That's why we address these with the x-rays. Like I said, most patients, it's cervical and lumbar, but we want to look at the areas that are most of concern. We want to get her started with our rehab. So in our next segment, we're going to introduce her to the spinal rehab system that we have here. It's a very simple system. It's not uncommon, but in a lot of chiropractic offices, they don't do this. We do it here, and it is a significant difference in this office compared to others in making people better faster. So see you next time.